Welcome back to my channel, Learn with Professor Genula. If you're new here, don't forget to subscribe and hit the bell icon for notifications. In today's video, we're going to learn about bleeding in early pregnancy, in which we will see about abortion here. Let's get started. Bleeding during early pregnancy, which means before 20 weeks of gestation, is a common but serious sign. Let's see about what it may indicate. First, it can suggest that something is not going well with the pregnancy. Second, it may also show that there could be a problem with the mother's health. Understanding this early sign helps in seeking timely care and preventing complications. Bleeding in early pregnancy refers to any vaginal bleeding that occurs before 20 weeks of gestation. Early assessment is very important because bleeding can be a sign of underlying problems. It may indicate that the pregnancy is not developing normally, such as in cases where the pregnancy ends on its own, the embryo grows outside the uterus, or abnormal tissue forms instead of a normal pregnancy. Delaying medical care can lead to serious complications, including heavy bleeding, infection, or even life-threatening outcomes. Early recognition and prompt treatment help ensure the safety of both the mother and the pregnancy. Bleeding in early pregnancy can occur due to several conditions. First, it may happen because of an abortion or miscarriage, which means the pregnancy ends before the fetus is developed enough to survive, usually before 20 to 24 weeks. Second, it can be caused by an ectopic pregnancy, where the fertilized egg implants outside the uterus, most commonly in the fallopian tube, and this situation is dangerous for the mother. Third, bleeding may also result from a vesicular mole, also called a hydatidiform mole, where abnormal placental tissue grows inside the uterus instead of a normal pregnancy. Recognizing these causes early helps in providing timely and appropriate care. Now we will see about abortion, which is one of the causes of bleeding in early pregnancy. Abortion, also called miscarriage, refers to the termination of pregnancy before the fetus is able to survive outside the womb. This usually happens before 28 weeks of gestation or when the fetus weighs less than 1,000 grams. It is an important condition to understand because early identification and proper care can help prevent complications for the mother. Now we will see about the common types of abortion. Spontaneous abortion happens naturally when the pregnancy ends on its own, without any intentional action. Induced abortion is when the pregnancy is ended on purpose, using medicines or a procedure. Eugenic abortion is done when the fetus has serious genetic or congenital problems that affect survival or quality of life. Sex-related abortion happens when a pregnancy is terminated based on the sex of the fetus. And this is illegal and unethical in many countries, including India. Understanding these types helps promote safe and responsible reproductive health practices. Now we will see about the different types of abortion. In threatened abortion, there is bleeding, but the cervix is still closed and the pregnancy may continue. In inevitable abortion, bleeding becomes heavier, the cervix opens, and the pregnancy cannot continue. In incomplete abortion, some of the pregnancy tissue is expelled, but some remains inside the uterus, causing continued bleeding. In complete abortion, part of the process is complete. All the pregnancy tissue has been expelled, and the uterus becomes empty. Finally, in missed abortion, the fetus has died but is still retained inside the uterus without any bleeding. Understanding these types helps in identifying the condition and providing proper treatment. Now we will see about the classification of abortion, which occurs without any intentional interference, and is therefore called spontaneous abortion or miscarriage. First, let's see about threatened abortion. In this condition, there is vaginal bleeding in early pregnancy, but the cervical opening remains closed, and the size of the uterus matches the gestational age. Because of this, the pregnancy may still continue. Second, we will see about inevitable abortion. Here, the woman experiences bleeding along with abdominal pain, and the cervical opening is already open. The products of conception are still inside and not expelled yet, and in this situation, the pregnancy cannot continue. Now we will see about incomplete and complete abortion, which are also types of spontaneous abortion. First, incomplete abortion happens when some of the products of conception are expelled, but some remain inside the uterus. This leads to heavy bleeding and the cervix stays open. In this condition, the uterus needs to be emptied through a medical procedure to prevent complications. Second, complete abortion occurs when all the products of conception have been expelled. In this situation, the uterus is well contracted, the cervix is closed, and the bleeding is usually minimal. Understanding these differences helps in providing the right treatment at the right time. Now we will see about missed abortion and septic abortion. First, missed abortion occurs when the fetus has died but remains inside the uterus. In this condition, there is usually no bleeding. The uterus may be smaller than expected for the gestational age, and fetal heart sounds are absent. If the dead fetus stays in the uterus for more than 4 weeks, there is a risk of developing a serious condition called DIC, which affects blood clotting. Second, septic abortion happens when an infection develops after a spontaneous or induced abortion. The woman may have fever, foul-smelling vaginal discharge, and pelvic pain. If not treated quickly, the infection can spread throughout the body and lead to sepsis or septic shock, which can be life-threatening. Now we will see about induced abortion, which means the intentional termination of pregnancy. First, let's see about medical abortion. This method uses medicines recommended by the World Health Organization, starting with mifepristone taken orally, followed by misoprostol, which can be used vaginally, buccally, or sublingually. Medical abortion is usually effective up to 9 to 12 weeks of pregnancy, depending on the protocol. Second, we will see about surgical abortion. This includes procedures like manual vacuum aspiration, which is preferred up to 12 to 14 weeks, and suction or electric vacuum aspiration, which is also commonly used. Other methods include dilatation and curettage, although it is less commonly used now, and dilatation and evacuation, which is performed from 14 to 20 weeks. These methods are chosen based on gestational age, clinical condition, and available resources. Now we will see about the difference between dilatation and curettage, known as D&C, and dilatation and evacuation, known as D&E. First, D&C is a procedure where the cervix is dilated and the inner lining of the uterus is scraped using a curette. This method is usually done in early pregnancy, up to about 12 weeks. The technique may involve a sharp or blunt curette and may or may not use suction. It is commonly used for managing incomplete abortion in early pregnancy. Second, D&E is done in later pregnancy, usually in the second trimester, around 14 to 20 weeks or more. In this procedure, the cervix is dilated and the uterine contents are removed using a combination of suction, forceps, and curettage. Because it is used at a later gestational age, it requires a more advanced technique to safely evacuate the uterus. Understanding these differences helps in choosing the appropriate procedure based on the clinical situation. Now we will see about the maternal factors that can lead to spontaneous abortion. First, genetic abnormalities are one of the most common causes, especially in early miscarriages, where the fetus has chromosomal problems that prevent normal development. Second, endocrine disorders such as diabetes, thyroid problems, and luteal phase defects can also interfere with a healthy pregnancy. Third, uterine anomalies like a septate uterus or bicornuate uterus make it difficult for the pregnancy to continue normally. Infections like torch infections, malaria, and urinary tract infections can also increase the risk. Systemic diseases, including kidney disease and high blood pressure, may affect the mother's overall health and contribute to miscarriage. Immunological causes, such as antiphospholipid syndrome, can interfere with blood flow to the placenta. Trauma to the abdomen and severe malnutrition are additional factors that may lead to spontaneous abortion. Understanding these causes helps in early identification and better management. Now we will see about the fetal and placental factors that can lead to spontaneous abortion. First, fetal factors mainly include chromosomal abnormalities, which account for nearly 60% of miscarriages. These abnormalities prevent the fetus from developing normally, leading to early pregnancy loss. Second, we will see about placental factors. Placental insufficiency occurs when the placenta cannot supply enough oxygen and nutrients to support the pregnancy. Another cause is abnormal implantation, where the fertilized egg attaches improperly to the uterine wall. Both these conditions affect the stability of the pregnancy and may result in miscarriage. Next, we will see about the clinical features of spontaneous abortion. The most common sign is vaginal bleeding, which may start as light spotting and progress to heavy bleeding. Another important feature is cramping pain in the lower abdomen, which happens as the uterus contracts. In some cases, there may be passage of tissue, especially in incomplete or complete abortion. Cervical changes can also be observed, where the cervix may be open or closed, depending on the type of abortion. In missed abortion, one key sign is the absence of fetal heart sounds. Recognizing these clinical features helps in early diagnosis and prompt management. Now we will see about the important investigations used to assess spontaneous abortion. First, ultrasound is done to check the viability of the pregnancy and to see whether the products of conception are still inside the uterus or already expelled. Second, beta-HCG levels are measured to observe whether the hormone is rising or falling, which helps in judging the progress of the pregnancy. A complete blood count is done to look for anemia or signs of infection. Blood group and Rh typing are also essential because Rh-negative women need anti-D prophylaxis to prevent complications in future pregnancies. A coagulation profile is advised if the fetus has been retained for a long time, as this increases the risk of developing DIC. Finally, culture and sensitivity tests are done when infection is suspected, helping the doctor choose the right antibiotic. These investigations guide proper diagnosis and timely management. Next, we will see about the management of different types of spontaneous abortion. First, for threatened abortion, the usual advice includes taking bed rest, even though the evidence is limited, avoiding intercourse, and treating any underlying problems such as urinary tract infections. Progesterone may be given if it is indicated. Serial ultrasounds are done to monitor the progress of the pregnancy. Second, for inevitable and incomplete abortion, the priority is to stabilize the patient, especially if there is heavy bleeding. After stabilization, the uterus needs to be emptied. This can be done using manual vacuum aspiration or suction evacuation, and medications called oxytoxics may be used to help control bleeding. Proper and timely management helps prevent complications and supports the health of the patient. Now we will see about the management of complete abortion and missed abortion. First, in complete abortion, the products of conception have already been expelled, so the main approach is simple observation. An ultrasound is done to confirm that the uterus is completely empty and no tissue remains inside. Second, in missed abortion, where the fetus has died but is still retained in the uterus, management can be either medical or surgical. Medical management usually involves giving misoprostol to help expel the retained tissue. If medical treatment is not suitable or not effective, surgical options such as manual vacuum aspiration or dilatation and curettage can be performed. It is also important to monitor the woman for signs of DIC, especially if the retained products have been present for a long time. Proper monitoring and timely intervention help ensure safe recovery. Now we will see about the management of septic abortion, which is a medical emergency. The first step is to start broad-spectrum intravenous antibiotics, such as a combination of clindamycin and gentamicin, to control the infection. At the same time, fluid resuscitation is given to maintain blood pressure and stabilize the patient. Once the patient is stable, the uterus must be evacuated to remove any remaining infected tissue. If the woman shows signs of septic shock, immediate treatment is required to support vital organs and prevent life-threatening complications. Early and aggressive management is essential for saving the patient's life. Now we will see about the complications that can occur after an abortion. Immediate complications include heavy hemorrhage, which can quickly lead to shock if not treated promptly. Unsafe procedures may cause uterine perforation, where an instrument accidentally makes a hole in the uterus. Infection is also a serious risk. If it spreads, it can lead to sepsis, septic shock, and a dangerous condition called DIC. Cervical injury can occur as well during manipulation of the cervix. Late complications may appear weeks or months later. These include infertility, often due to scar tissue formation inside the uterus, known as Asherman's syndrome. Some women may experience chronic pelvic pain or face recurrent abortions in future pregnancies. Understanding these complications helps in ensuring safe practices and early intervention when needed. Now we will see about the legal and ethical aspects of abortion in India. Abortion is legally allowed up to 20 weeks of pregnancy, based on the opinion of 1 or 2 registered medical practitioners, depending on the situation. For special categories of women, such as survivors of rape, minors, or those with certain medical conditions, the law permits abortion up to 24 weeks. The consent of the woman is mandatory, meaning no one else can decide on her behalf. Confidentiality is also strictly protected, ensuring that her personal information and medical details are not disclosed. These guidelines help ensure safe, respectful, and ethical care for women seeking abortion services. Now we will see about the role of the nurse in caring for women undergoing abortion procedures. First, during the pre-procedure phase, the nurse checks baseline vital signs and explains the procedure to the woman, ensuring informed consent is obtained. Providing emotional support and counseling is also an important part of care. The nurse prepares the woman by establishing IV access and assisting with required investigations. Second, during the procedure, the nurse supports the physician, whether it is manual vacuum aspiration or medical abortion. The nurse also closely monitors the woman's vital signs, bleeding, and level of pain to ensure safety throughout the process. Here we will see about the post-procedure care that nurses provide after an abortion. After the procedure, the nurse closely observes the woman for any complications such as bleeding, shock, or signs of infection. Pain relief is given through analgesics, along with any other prescribed medications. If the woman is Rh negative, the nurse ensures that Rh prophylaxis is administered. The woman is also educated about important danger signs that require immediate medical attention. Counseling is another key part of care. The nurse offers emotional and psychological support, discusses family planning and contraception options, and provides guidance on follow-up visits to ensure complete recovery. Now we will see about the ways to prevent unsafe abortion. One of the most important steps is public education, which helps women understand safe practices, available services, and the risks of unsafe procedures. Access to contraception is another key measure, as it helps prevent unwanted pregnancies and reduces the need for abortion. Providing safe and legal abortion services ensures that women receive proper medical care in a protected environment. Early antenatal registration also plays an important role because it helps identify pregnancies early and allows women to receive timely guidance and support. Together, these measures help improve maternal health and reduce complications related to unsafe abortion. That brings us to the end of today's session on bleeding in early pregnancy, in which we have seen about abortion. In the next video, we will see about ectopic pregnancy. I hope you found this video informative and helpful. Thank you so much for watching. And don't forget to like, comment, share, and subscribe for more nursing and health-related content. See you in the next video.